Welcome back to Jenny's World, keeping it fresh, keeping it real and definitely keeping it middle-aged. Now don't forget to follow me on Instagram and Twitter, and also subscribe to my YouTube channel, Jenny's World. Also, please take some time to have a look on my website. There's some really good stuff on there. It's new-ish, it's been out there for a while, so I'm really trying to get people to go on there, visit, have a look around. There's some really good things out there that will help you emotionally, give you things to look at, have a bit of a laugh, and there's some information about keeping children entertained. So don't worry, all the details are down below in the description box. Now today I'm going to talk about, again, hot topic, COVID-19. Now there's lots of different stories going around about what's going on. I mean, recently in the news today, and over the last few days, is about PPE and the fact there's been new guidelines saying that they can be reused. Now, we all know, because we've read, it's been quite openly reported, that there is a shortage of PPE for doctors and nurses and anybody who needs to be giving care to people who have COVID-19. Yet now, we've been told they can actually reuse it, and certain items of their PPE equipment that they're able to reuse. Now, I just don't understand how that's possible. I mean, first of all, how are we still in this place where we're 4 weeks into lockdown? The first cases were reported back in early March, I think, or maybe in the first death, and we're still now middle of April, and there's still not enough PPE equipment to go around. And as a way to get around that, they've changed the guidelines to say that you can reuse certain items of PPE. Now, to me, that is outrageous. I mean, as a healthcare professional, you're putting your life at risk by treating these patients. And we've all read the stories of nurses having to create their own PPE from bin bags, having to order them off Amazon or have them donated. And the government are telling us that they have millions of this equipment, but there's an issue getting it transported. It's like, how? It's not as if there's a lot of people out there on the road, so it's not as if you've got traffic to contend with. You've got most of the country in lockdown, stuck at home, unable to leave. With a small percentage being able to go to work because they have to, because they're essential. And yet you're unable to get this vital equipment out to the people on the front lines who are putting their lives at risk to help save other lives. And you, the government, can't get that equipment there. And as a result of this shortage of PPE equipment, they've now changed their own guidelines that says you can reuse certain PPE equipment. Now, I'm not a nurse or a doctor. I don't look after people in dangerous situations, but I would not feel safe if I had to reuse PPE equipment. And I'm sure that's the same that's being said for those very doctors and nurses and caregivers who are on the front line day in, day out, and having to be told you've got to reuse this equipment, which could have been, sprayed on by patients as they're coughing, sneezing. And the whole point, just generally speaking, and everybody knows when you're going to hospital and they're wearing a gown or mask, it's all disposable. They don't reuse it. And that's just before we had this pandemic. And now we have a pandemic and they're being told that you can reuse it. That is just unsafe, and I think it is just showing how, with one breath, the government says how vital, how much they respect and cherish our NHS workers, but in that other breath, they're saying reuse this equipment at your own peril. Now, hopefully, doctors and nurses will just have to make a stand on this, because you're putting your lives at risk already, and you've got that equipment there. But without having new equipment that you can use every day fresh, and being told you have to reuse equipment you've used before, that's putting your life even more at risk. And now we're down to a point of, well, whose life is worth more? The nurses and doctors who are trying to save you, or the patient who comes in with those symptoms? I mean, I think it's putting our healthcare workers in an impossible situation, that they have equipment that's already been used, but if they don't wear it, they can't treat the patients. But if they do wear it, they don't know if they're actually going to be infected, if they're going to catch anything. So how is it that the government can get away with changing this advice and expecting our healthcare workers to adopt it? Now, I really hope that this is something which changes immediately, and that the government do all they can to get that vital PPE equipment out to all of the nurses and doctors who need it, to all those hospitals, to all those care homes. Everybody who working with people at risk should have the necessary equipment to do their job. Because remember, they all have families, they all have loved ones, they all have people they're going back home to. So it shouldn't be that they have to make a choice. Do I do my job or do I risk my life? Because that's how I feel the situation is. That's what the government is actually saying when they say you can reuse this PPE equipment. And obviously, the people who are saying this, they're not the ones in the hospital, they're not the ones in a care home, they are not the ones who are treating these patients day in, day out. They're safer way just giving out this advice without actually having to be on that front line. And I wonder if they were the ones who were actually giving out that advice, who were actually treating those patients on the front line day in, day out with these patients who have COVID-19 and who some of them die, a large number of them are dying every day, would they still feel that the recommendation that they are giving is correct? I very much doubt it. Now, I hope that the doctors and nurses rebel enough and say enough's enough. We are here and happy to help treat these patients, but we need vital equipment. Also in the news was that some hospitals are at risk of running out of their PPE equipment within 24 hours or 48 hours. So by Monday, there could be a position where there are no PPE equipment in some hospitals. What happens then? With no equipment, they are not able to treat those patients who are ill and need their help. So what is going to happen? Are they going to have to risk their lives by making makeshift PPE equipment? Are they going to have to go and buy it themselves from the Amazon or the few shops that actually sell it? What about those patients? If they don't get the care, they're not going to survive. So let's really hope that the government does something shortly and within the next 24 hours to get more PPE equipment out there to protect our NHS workers who are putting their lives on the at risk to manage this pandemic and ensure that they're able to help patients who need it the most. And let's not risk the lives of those patients, the people who are catching it through no fault of their own. Let's not risk their lives by not having enough equipment for the doctors and nurses to do their jobs. So I really hope that everybody out there just does what they can to get the message out and to make the government listen and do what they need to do and should have done a while ago in getting out that equipment to all of these hospitals, but especially those who are reporting that they're going to run out by Monday. We're not talking 2 weeks away, Monday, within 48 hours at the latest. They are reporting that some hospitals will not have PPE equipment left. So forget about reusing anything. If they don't have anything, what is there to reuse? So we've got two things on there. A shortage of the PPE equipment. Hospitals due to run out within 24 to 48 hours. And then we have a change in the guidelines by the medical profession that is now saying they can reuse certain items of PPE. Now, who wants any of those situations to happen? We need to make sure that equipment's out there quickly to those hospitals who need it, and that we are not reusing PPE equipment. That all of this equipment, which apparently the government says they have, they keep saying we have it, but they can't get it to the hospitals in the right time frame with the right amount. And I know during the week there have been reports that equipment that have come in has been mislabeled. So when they think they're getting gowns, it's not been gowns. When they think they've been getting masks, they haven't been getting masks. It's been something completely different. That has got to stop. We're in a crisis situation as it is with COVID-19. We do not need to have another crisis with the PPE. This has been talked about for weeks. It's not new. It's not something which has just happened. The government already knew hospitals were struggling with this equipment. So why has it taken so long? Why have we not resolved this? They've been getting the army in to help distribute this, and it's still not getting there. So somewhere, something is not working. And we've now reached a critical point for our healthcare professions who will seriously, even more than they have done already, who will seriously have their lives put at risk. Because I'm sure there's lots of doctors and nurses who may take that decision to say, do you know what, I'll reuse it because I need to treat this patient. I'll reuse it because this person is really at death's door, and if I don't intervene, they will die. And they're putting themselves and their families at risk by doing that. And that is something which I just feel we can't have happen. We have to make sure that the government listens and does what it can and should be doing to get the equipment out there, so it doesn't have to be reused, that they can just use fresh equipment each day or as often as they need to do so. So we all know that without these healthcare professions, this pandemic will be a lot worse. The death rate will be even worse than we're having already. And we don't even know if we're even at the curve, missed the curve, or the curve's already gone. And if it hasn't, I mean, yesterday there were reports of still over 800 deaths. So are we going lower, higher? It seems to me that we seem to go up and down. But if this continues to happen and we don't have the healthcare professionals in the hospitals to deal with that, surely that will mean that the death rate will rise. And again, we're going to be in an impossible situation. No equipment, no doctors. So people will just keep catching this disease, not being treated, and it will get worse, and the death rate will continue to rise. So I urge all of you who are watching this video to get that message out there, talk about it, protest about it, and so we can all do what we can to make the government listen and for them to really take this as a matter of urgency to get the necessary equipment out to the front line, to the doctors, to the nurses, to the caregivers who are treating these COVID-19 patients each and every day, and who every day putting their lives at risk for each and every one of us. That's the least we could do to help keep them protected and their families protected. Now, I'm going to wrap it up there just on this topic, but I will come back shortly for another video where I'm going to talk about other things that are happening as a direct result of COVID-19, not necessarily in the UK, but in other countries. So please stay tuned and come back. So thanks for watching. Don't forget, keeping it real, keeping it fresh, and definitely keeping it middle-aged.